This week's presentation will be on the U.S. healthcare delivery system. About the U.S. healthcare system, the United States spends more money than any other country in the world on healthcare, and more Americans worry about the cost of medical care than any other countries. Yet, do you know that there are many reasons why the U.S. spends more, and then some of those are because of government policies that drive up cost. Most working age Americans obtain health insurance through their employers. They do not pay directly for health services, and they do not even directly choose their health insurance provider. This means that many Americans have no reason to consider cost in making healthcare decisions, which, of course, encourages overconsumption and makes it possible for health service providers to charge higher prices. Um, the U.S. healthcare spending grew 4.6% in 2019, reaching 3.8 trillion, or you can see that as being $11,582 per person. As the share of the nation's gross domestic product, health spending accounted for is 17.7%. Moving on, the U.S. versus other countries is significantly higher than those of other developed countries, of course. This is because even before, the pandemic, the United States spent a significant portion of its resources on healthcare without generating, better outcomes. The amount of resources a country allocates for healthcare varies based on its political, economical, and also social characteristics. Of course, since every country in the world has been affected by the coronavirus pandemic, which has strained healthcare systems and economies across the globe, the United States is no different, as the pandemic has also affected the health, jobs, and income of millions of Americans. As the country eventually recovers, the cost and quality of our healthcare system will remain a pressing challenge. Generally, wealthier countries such as the United States will spend more on healthcare than countries that are less affluent. As such, it helps to compare healthcare spending in the United States to spending in other, of course, wealthy countries. Um, as such, it helps, of course, comparing healthcare spending in the United States to other wealthy countries. Another point is those with the largest economies, as well as those with both a GDP and GDP per capita that is above the OECD median. The pandemic has significantly undermined health insurance coverage in the United States, with the sudden surge of unemployment exceeding 20 million workers, has caused many Americans to lose employer sponsored insurance. A recent Commonwealth Fund survey showed that 40% of respondents of their spouse or a partner who lost a job or were furloughed had insurance through the job that was lost. Although many will continue, of course, to get employer coverage or become eligible for Medicaid or certain marketplace plans, a substantial number will probably become uninsured. Um, Even workers who keep their jobs may find their coverage dropped or, you know, curtailed as financially strained employers cut costs. These developments will add to the 31 million people who are uninsured and more than 40 million will be, it's more than 40 million people estimated, of course, to be uninsured before the end of the pandemic, which is something that is, very eye-opening. Dealing with something that costs, and not every American can afford, and is also not available to every American. And having the effects of COVID, it's been a struggle for most families. It's really hit hard for different demographics, of course. African Americans, Latinos, people who are generally affected by the pandemic or who have felt it hard.